Alrighty, everyone. So I just saw that clock turn to 12:15. So we're going to go ahead and jump right into this and get started just because I have a lot of information to pass along to you. So before we get started, I just have a disclaimer here to read over. So this information is being provided to increase your awareness. It is not intended to be medical advice. If you believe that you may have any medical conditions or have specific questions regarding your health, please see your physician. All right, and then before we do get started into the topic of heart disease today, I do just want to thank you for joining today's Wellness Wednesday session. My name's Emily, and I will be taking you through the topic today. In this session, we're going to define what heart disease is and review the risk factors for heart disease. I really hope that you leave today's session just with a better understanding of how you can lower your risk and make healthy choices to improve your heart health. So let's define what heart disease is. So when we talk about heart disease, we're talking about a range of conditions that affect our heart. That includes blood vessel diseases like coronary artery disease, heart rhythm problems, heart defects that you were born with or you may have developed as you got older, hardening of the arteries, and hardening or weakening of the heart muscles, and heart infractions that were caused by bacteria and viruses that you had. Many forms of heart diseases, they can be prevented and treated with different healthy lifestyle choices. Now, while there are many types of heart diseases, today we are going to talk about the most common, which is the coronary artery disease or CAD. So CAD, this occurs when the arteries that supply the blood to the heart muscles becomes hardened, and they become narrow due to the buildup of cholesterol and plaque in the inner walls of our heart. And then as this grows, less blood flow goes through the arteries, and that results in heart muscles to not get enough blood or oxygen that we need. So this can lead to chest pain or even a heart attack. And then over time, CAD also weakens our heart muscles, contributing to heart failure then. So the good news is, though, I know that was heavy, heart disease is preventable. We just need to know our risks. So some risk factors we are able to change or we can control them, but other risk factors we're not able to change. So the ones that you can control are your blood pressure, having high blood pressure, your BMI, cholesterol levels, diabetes, diet, physical activity, and tobacco use. And then for those uncontrollable ones, our age, family history, and our gender. So let's talk more about blood pressure, because we said that's one of the controllable factors for heart disease. So this is a measure of the force of your blood pushing against the walls of your blood vessels. So there are two numbers for blood pressure that are the most important, or they're the only ones. So we have to pay attention to them. So the top number, or the systolic pressure, is the pressure your heart exerts when it's beating. And then the bottom number, or the diastolic pressure, is the pressure in the arteries when the heart is at rest or when the heart is between beats. When blood pressure is uncontrolled, it puts us at a higher risk for heart disease. So again, it's really important to know what our blood pressure is. And on the screen here, you see the ranges of blood pressures, and you could see what they mean. So it's important to get your blood pressure checked regularly because it does change often. It changes day to day and all throughout the day. And if it is high, there aren't really any signs for that. So again, it's good to just be on top of our blood pressure and check it regularly. A normal blood pressure is considered to be less than 120/80, and a reading of 130/80 is considered to be high blood pressure. The ranges, they can depend on person to person. Sometimes people are just naturally high, sometimes people are just naturally low, but it's a good idea to talk to your doctor about your blood pressure, just to have a plan on how to control it. So the primary way high blood pressure causes harm is by increasing the workload of your hearts and our blood vessels. That makes them work harder and less efficiently. And then over time, high blood pressure can lead to complications like heart failure, heart attack, kidney failure, and stroke. For some, high blood pressure can be controlled by lifestyle changes like having a heart-healthy diet, losing weight, doing regular exercise, and limiting alcohol intake. Other people and some people, you might require medications in addition to these lifestyle changes to lower your blood pressure. So with blood pressure, we also have to talk about high cholesterol, since it is a risk factor of heart disease. So it can increase the risk of plaque formation and can lead to a heart attack or stroke too. Often there are no signs of cholesterol. So just like there are really no signs of high blood pressure, same with cholesterol here. So again, it's important to get your cholesterol checked routinely. You just want to check with your doctor. Sometimes they recommend every 3 years, but if you're trending hot, having higher cholesterol, they might ask you to get it checked more regularly. So there are a few types of cholesterol. So the first one is LDL. So this is the bad cholesterol. You want this number to be low. A good way that I always remember it is LDL, the L. We want that to be low. There are the more LDL there is in the blood, the greater risk that you are at for heart disease. And then the next is HDL, or the good cholesterol. So this one, we want this number to be high. So the H, you could think of it as high. You want that to be higher for you. If your HDL levels are low, your risk of heart disease, that increases. And then lastly, on your screen here, we have triglycerides. This is the most common form of fat in food and in our body. And then like LDL, we want this number to be low as well. So on your screen, you see the recommended cholesterol ranges. There are general recommendations, but your own recommendations, they have different ranges, and they may vary based upon your medical history. So again, it's really important to talk to your doctor about where you should be and kind of creating a plan of what to do to move forward to keep those cholesterol ranges in the normal ranges where we want them to be. So if you are a smoker, quitting is one of the best actions to take for our heart, right? We know that we always hear we want you to stop smoking. But even if you're not a smoker and you're around people who do smoke, we want to avoid that secondhand smoke. When smokers stop smoking, the risk of heart disease drops right away, in the first minute, in the first day, week. And then after 10 years of quitting, the risk of death from heart disease is about the same number for people who have never smoked. So if you are a smoker and once you stop, your body starts to slowly get back to its normal state. So always a good idea to think about quitting. And then, like I've been mentioning, there are preventative measures that you could take to lower your risk of heart disease. The first one on your screen here is to exercise. Physical inactivity and having a sedentary behavior that increases your risk of developing heart disease, as well as other chronic diseases that we want to stay away from. So exercise just helps you control your weight. It improves conditions like high cholesterol, high blood pressure. And the goal is to really aim for 30 minutes of moderate physical activity a day for 5 days a week. Now, this 30 minutes, it doesn't have to be all at once each day. It could be broken down into 10-minute increments, 15-minute increments, whatever works best for your schedule, just as long as you're staying active throughout the day. Then next is eat a heart-healthy diet. So this includes choosing whole grains, fish, and lean meats. increase your fruits and veggie intakes on your plate, limit saturated fats, and focus on limiting salt, added sugars, saturated fats, and trans fats as well. And then you'll want to limit alcohol to no more than 1 drink per day for women and 2 drinks per day for men. And then lastly, you want to maintain your weight. So this is achievable by following the first 3. So exercise, having a heart-healthy diet, and limiting alcohol. And some other prevention tips are to find a way to reduce stress. So you could do this in a lot of ways because managing stress depends on person to person. You could meditate, you could journal, do deep breathing exercises, practice yoga. You could do that at home or going to a class at the gym. Just a lot of different ways to manage your stress, even just sitting in a quiet room for 5 minutes or whatever works for you. You'll also want to follow your doctor's directions on how to take prescribed medications. And if you want to change your medications at all, talk to your doctor, see what they recommend. And you could also talk to the pharmacist too, to just get a second opinion as well. Then the key takeaways here, just to wrap it up from today, are to manage your blood pressure, your blood sugar, and your cholesterol. So you could see here, according to the CDC, about half, 47% of Americans have at least one of the 3 key risk factors for heart disease. So just something to think about. You want to get your annual checkups with your doctor. I think I said it a few times already, but make sure that you're talking to your doctor regularly, going to your regular checkups, and it says your annual checkups here, but if it needs to be more routine than that, then again, just talk to your doctor to figure out a plan that's best for you. And then practice healthy lifestyle changes. So exercising, eating a heart-healthy diet, managing that stress, and then just maintaining a healthy weight. So again, I just want to thank you for joining the session today. That was a lot of information I threw at you. So if you do have any questions, please send us an email at wellness@geisinger.edu, and we will get back to you with the answer for you. I hope you have a great rest of your day, a great week. Enjoy the nice weather we're having.